Welcome to the Ally Project Spring Semester's second event. We're honored to have Dr. Kimberly Ho, a speech language pathologist, a board-certified behavior analyst, as well as an assistant clinical professor at the Bouvé College of Health Sciences at Northeastern University. In this presentation, she brings her expertise in augmentative and alternative communication and autism to view disability through a neurodiversity-affirming lens. Her presentation, Understanding and Supporting Neurodivergent Student, Professors, and Colleagues, Explore Inclusive Practices, Universal Design for Learning, and the Importance of Listening and Honoring Autistic Voices. Let's get started. All right, everyone, welcome to our second event of the semester. Our guest speaker today is Dr. Kim Ho from my dear apartment in the field of speech language pathology. And today our sign language interpreters are Lucy, Annette, and Nicole Sasson. And I will pass it on to Dr. Ho.
So I'm just going to introduce myself a little bit. As Mary said, I am a professor I'm an assistant professor in the Communication Science and Disorders Department. I'm a speech language pathologist, and I've practiced for a little over 25 years. And I specialize in augmentative and alternative communication for those with little or no speech. And that's sort of why I became a speech pathologist, because that was my favorite population to work with. In the last 10 or 15 years, that's been even more specialized to autistic people, because that tends to be a lot of AAC users, and it's just really emphasized my interests. Also in the last year, I became a BCBA because many of my clients benefit.
What does that mean?
It's a board certified behavior analyst, so it's ABA, so supervising behavior technicians that are working with individuals that are autistic. And a lot of times SLPs, speech language pathologists like myself, don't work as well with ABA folks. There tends to be kind of fights because they have different perspectives. Yeah.
What kind of fights?
Fist fight. Every profession has their own, kind of theory and background, and of course the way they're educated. And so everyone has that thought that, well, speech is the best, and ABA folks think, well, ABA is the best. And occupational therapists and
Is it though, right? Different opinions.
Well, different opinions, and they're all really trying to do the same thing, is to help students, help individuals to be happy and independent. And so about, 8 years ago, I was hired from my private practice full time, where I was just working with a lot of different AAC users, to become the director of speech and AAC services at an ABA clinic, which was my first real exposure to ABA. So initially I thought, okay, whatever, I'll just do my thing, help them. And then I started to learn more and more about actually what they were doing. And, I always had a small number of clients on my caseload that I felt like really weren't making that much progress. And I was doing all the things I thought were just the thing to do, and they still weren't making much progress. And through ABA, I learned how to really take data and graph your data and really think about it, and day to day decide, all right, is what I'm doing working or not? No, the data is showing it's not working, so let's change it, but change one thing at a time. Whereas in the past, I'd be like, oh yeah, let's change it all up.
Okay, so we use like a scientific about it.
Exactly.
Like scientific method.
Exactly. So ABA is the science of behavior. So versus a speech pathologist, which is also, we learn about
No,
science.
so if a speech pathologist was here, they'd be like, no.
Well, yeah, sometimes their perspectives are just a lot different. But anyway, I learned all these skills on how to really analyze my data and to help those individuals that sometimes do things that can hurt themselves or be aggressive to other people because they're not feeling regulated. And ABA professionals are really good at helping to figure out why someone's engaging in a certain behavior, and then to communicate that in a different way. So anyway, yes.
I did have a quick question. Dr. Kim, so does ABA, is it an abbreviation for something?
Applied Behavioral Analysis. Yeah, good question. Yeah. So that's why I became a BCBA, because I felt like I could do it better.
What's BCBA?
board certified behavior analyst. Yeah. So I became that just so that I could do a better job, and because I saw so much of this of speech pathologists and ABA professionals just like fighting, not getting along, which of course isn't helping our clients. And I have 3 children myself who are all grown or almost grown, and all of them are neurodivergent, and one has ADHD and is autistic. And now I've learned that my husband has a lot of autistic traits. And then 2 years ago, I said to my therapist, you know what? Maybe I have ADHD or I'm some way neurodivergent. Sure enough, I'm very much ADHD. So that was only 2 years ago I learned this. So it's helped me a lot, my self-esteem, the imposter syndrome. And I'm so lucky to now share an office with a neurodivergent person. And we're so out about our neurodivergence in our department that at faculty meetings, the other neurodivergent faculty, I mean, it's a life-changing thing to be able to self-disclose and learn about it as a community and as a culture. So changing from me being a professional, learning how to help people, now I'm learning more how is your culture different than mine? And yes, I'm actually, if I take off my mask and stop pretending I'm neurotypical, I realize that I behave in a different way, and it's just changed a lot of things about me. So I'm very passionate about learning how to be neurodivergent affirming, and I've now, moved to really focusing a lot of my work on that because I think it changes all of us in a good way. Okay, so I always start by considering the model that we're using to look at disability, and the medical model is just the typical way people have learned to look at disability. And it's not the ideal way. And we're moving from it, but we still, definitely speech pathology in general is still in the medical model, as is ABA and many others, education, many other aspects of care for people with disabilities. The medical model looks at someone with disabilities and compares them to someone without disabilities. So here we're talking about someone who's neurodivergent, someone who's autistic. Neurodivergence, the umbrella is very wide, a lot of different things, but someone has ADHD, learning disabilities, autism, all these different ways of being, though that's a different neurotype altogether. And it's not really kind, friendly, or helpful to compare someone and say, oh, they're broken. This is what's wrong with you, because compared to the neurotypical standard, there's all these things that we need to fix. And the aim becomes, how do we cure autism? How do we improve this disability? Versus the neurodiversity-affirming framework is where you look at disability as something that really is a reaction of others not accommodating your needs. So the model that's usually given is, you think of someone who's using a wheelchair, they're disabled, they cannot enter a building because no ramp was provided. So provide a ramp, that person's not disabled in that way. People that are in the autism community often do want to say that, yes, this is a disability, but it's also my identity. And this is a neurodivergence, and this neurodivergence has always been here since the beginning of time. It's a part of every population of people. And the goal becomes, instead of normalization and trying to teach someone how to act like they're not autistic, the goal becomes, how do we optimize outcomes for you based on your needs and your strengths? And it's much more centered around the individual. If you look at the medical model and we look at stimming, it's often called stereotypy and looking at how can we minimize these behaviors that look different from a neurotypical person, versus looking at stimming as a way of being, a way for someone to express joy, maybe to self-regulate if someone's nervous, and just accepting that as a different way to behave that is kind and honest to your neurotype.
What is stimming?
Stimming is a repetitive behavior that someone can engage with just to calm themselves. Yeah, hand flapping is the most common example for autistic
Like
people.
hand flapping.
Yeah.
Shaking the hands.
So shaking hands back and forth, just to calm. They usually.
Sorry, I've never actually seen somebody.
Yeah. You definitely have stim probably yourself, like even if we jiggle our chair back and forth, like I see
Oh,
Mary
100%.
doing.
Sometimes I knit.
Yeah, knitting is such a great trick that a lot of people use to self-regulate.
Changed my life. I went to a conference recently,
Yeah,
and I think partly maybe because I can't see, or I don't know, like I need something to focus, like
Yeah.
keep my hands busy.
Yep.
I was like probably the weirdo, right, that came in
yeah.
and just sat cross-legged and just took out my knitting in the middle of the biophysical society.
When I attend a conference, I'm happiest when I'm presenting because I stand in front and I can move around and I don't have to sit still. But when I'm going to any sessions that I'm not presenting at, I sit in the back on the floor so I can change my position a million times. I'm not much of a hand stimmer, but my body has to be moving all the time.
Nice.
Yeah, and I sat next to, at the last conference I went to, it was a national speech conference, and there was a person sitting next to me with a little box, and she took out the tiniest little pieces of paper and made origami. And that was her stim, and she said she has to do that to focus. It was the most creative stim I'd ever seen. It was really
Yeah, like
amazing.
the knitting, I didn't realize how much more I was able to absorb.
Yeah.
I was just like,
yeah, right, exactly. So when we tell an autistic person, quiet hands, and so that you can learn, oftentimes that makes them the person focusing on how to look neurotypical. So that means masking how they actually are. And then, make eye contact, look at me. And for a lot of people, like my autistic child will say, that means I can't really listen to you because I'm so uncomfortable making myself look at you. Plus holding I know for myself, when I'm going to have to learn something, I put on my earplugs, listen to a webinar, and I clean my house. And that's how I can pay attention. So you have to let the person learn how they learn best and then let them do that. So self-advocacy is the most important thing. The last thing on this chart is when we prioritize that speaking, spoken verbal communication and making eye contact, like I mentioned before, those are neurotypical norms that you're pushing on a community that's not right for them. So instead, I've learned, and I'm definitely have been guilty of this, like I've specialized in AAC and I know AAC helps speech. So use that device. Oh, I know what you're saying, but say it this way. I no longer do that. Now, if a person takes my hand and guides it somewhere, then I'll model on the device, say, oh, you want cookie? I'll give them the cookie.
what's AAC?
That's that augmentative and alternative communication. So it could be pictures or sign language, anything besides speech that you use either instead of speech or just in addition to speech to help you communicate. Yeah,
Have you ever had like a blind person so that they couldn't necessarily see the images?
Yes, I have a client right now who's blind. She has moderate intellectual disabilities and she's blind. And she uses a very complex AAC device. It has 84 buttons and then thousands of messages. But with a plastic key guard on there, she then knows where it's all motor automaticity, like typing. Like she knows how to get to all the buttons. And
She has 84 of them memorized.
Yes, she has hundreds and hundreds. Yeah.
Oh, no, you memorize your entire lectures.
No, I understand, but like I feel like, but I can speak.
No, it's a good thing. And deaf blind people, they still use sign language, but it's different. They'll press their hand in their communication partners.
I have a question.
Yeah.
This was something that I was told before, and I want to know like if this is true. I was going to like there was like different types of like shoot. I don't know how to word the question. That's the thing. I'm trying to find out how to word the question, but like that there's like different types of autism.
Mm-hmm.
Like when we're like, like there's like different levels.
Right.
Yeah,
Yeah.
that's what I was like.
Yeah, great question. Yeah. So they always say if you've met one autistic person, then you've met one autistic person because every autistic person is so different.
Mm-hmm.
And people used to say, oh, a high functioning person versus a low functioning person.
That's what I was about to
ask.
ask.
That's not really acceptable. And if you wonder why, just think, oh yeah, I started dating someone. They're very high functioning. You wouldn't say that. It's just a weird thing to say. It's very judgmental. It's very, very neuronormative. Like you're taking, your neurotype of being a neurotypical person and however much they look like you, then they're good versus you're not good. Now what they say is support needs. So someone with high support needs just needs a lot of support to, just go about their day, and someone with low support needs. But it's important to know that someone with low support needs, like my child, sometimes is going to have high support needs just based on regulation. If someone is dysregulated, maybe because they're dehydrated or tired or getting sick or they're overstimulated, stressed out, then all of a sudden they may, like my child, will just completely shut down and not be able to communicate. Other people might engage in different behaviors, but yeah, so everybody's so different. Any other questions on the slide?
You're never going to get through your slides.
Yeah, it's all right. That's why it's more fun to just talk, isn't it?
Yeah, we can stop it.
I always like to talk about research that's being done by autistic researchers. We're getting more and more now, and we're so lucky to learn more from autistic people who are sharing their experiences. So double empathy problem that was talked about is how, have you ever heard, person with autism, and even that language, I've read, it's preferred to say autistic person or person on the spectrum. But an autistic person, they don't have anyone else's perspective and they're living in their own world. But that's not really true, as we're learning more and more from autistic people about the problem of masking and hiding your autistic traits because they're not acceptable. How can you go about doing that if you don't have other people's perspective? It's because you realize that how you're behaving and interacting with the world is not acceptable. So I better not. And I spent my whole life doing that. So obviously empathy is there, perspective taking is there. But this research was done by Crompton et al., where he just figured out this brilliant, simple design to look at comparing autistic people communicating, non-autistic people communicating, and then mixing the neurotypes. So the game of telephone you play as a child, you line up a bunch of children, you whisper a message, everybody whispers it to the next person, and you see at the end how bad was the message. Like it doesn't make it quite all the way through. So if you look at the data, autistic chains, non-autistic chains, the message got through. Of course, the longer the chain was, the more diffusion of message. But if you mixed neurotypes, that's when the message didn't get through. Well, why is that? It's not a problem of communication, it's just differences. It's like looking at cultural differences, communication norm differences. So isn't it? And it just shows you there's nothing to be fixed.
Especially given the spectrum of what an autistic person is, that
yes,
just like that, like if you just group them all together, then it's fine.
It's
It's amazing.
Yeah, so when my child has a friend over, they sit side by side on the floor. Each of the kids are on their computer and they're both gaming. They're not looking at each other mostly. They're not talking to each other all the time, but they're having a great time. They have a great friendship. And their communication style might be info dumping of really into this one character and the other one's listening while playing. And that's the communication style. So, there's no need for my child to go to social skills therapy to learn how to take conversational turns and talk about non-preferred topics, because that's really training that person that your style and the way of being is broken and wrong and sick, and we need to fix it. Okay. So here's just looking at some positive ADHD and autism traits. There's so many. This incredible attention to detail, thoroughness, spotting patterns, expertise. People talk about having a special interest, and some people will call it an obsession and try to keep them away from that or save it as a reward if they do what you want them to do. Whereas if you just let the person engage in whatever is their really strong interest, then they will develop an incredible level of knowledge and skill, and that will give them joy. So to me, just do what you need to do, and the world will be better for it. This incredible deep focus. Hyper focus is, for me, really helpful to my work, because when I get into a hyper focus, I can get probably 5 times as much done as a neurotypical, but the world goes away. So people, I try to, next week on spring break, I have a lot of big projects in mind. So I'm going to tell my partner, please, if I have my headphones on, don't talk to me. Because if someone comes and taps me on the shoulder, I will jump a mile because I'm gone. I'm so focused. And a lot of times people say, oh, someone with ADHD, it's a problem with attention. Well, it's an issue with regulating attention. But when we're focused and interested, then the focus is kind of superhuman. Novel approaches to solving problems. A lot of tech companies are actively recruiting autistic workers because the problem solving that happens that neurotypicals don't even think of. Incredible creativity and the acceptance. I remember when my autistic child, before they were even speaking, they were so compassionate and interested in disability. And they were always surrounded by disability because of my work. And I would always volunteer at all these different places. And I had a brother with disabilities. And so I remember when we were at a memorial service and they didn't have the words for Down syndrome, but they pulled on my arm and they pointed because they were a person with that Down syndrome, because they knew I would have to go over it. I'm just drawn to people with disabilities. I had to go talk to them. But, you know, a lot of that's just true in general. And an interesting fact is the percentage of people that are LGBTQ in the autistic community is much larger. And I have to wonder if that's because people are so much more accepting of you be who you are. Let's look at a little bit of terminology. We've talked about this a little already. If you're looking at neurodiversity-affirming language compared to medical model or ableist language, there's some differences. So a neurodiversity-affirming way of talking about autism is this: just say autistic, because it's the identity. You can't pull autism out of a person's identity because it's their brain, it's their entire way of being. So a lot of autistic people want to be called autistic or maybe on the spectrum, but prefer that over being called a person with autism, because to them that sounds like a person with cancer or something that you can't pull out. And recognizing differences versus labeling everything as deficits. Because if you Google right now ADHD or autism, you're just going to get all the deficits. It's all medical model. But you can look at all the incredible strengths and then needs as well as people have. And then, as we mentioned, the level of functioning versus calling someone, support needs versus talking about low functioning or high functioning. Any other questions about terminology? So in terms of supporting someone either in the workplace, the classroom, I find the universal design for learning super helpful. It's a great model for all people with disabilities, and particularly neurodivergent people. So you think about looking at equity compared to accommodation, compared to accessibility. You can say, oh, let's make everything equal. Then obviously that creates barriers for a lot of people with disabilities. Or you could accommodate by providing that ramp for that one student. Or you can make things accessible. And I think that's where we're really trying to move as a society, and we're really only at the very beginning. But to have things accessible to all neurotypes and all disabilities, that's really the ideal. And if you pull apart what happens in universal design, you're going to be making accommodations, and we already have those from ADA compliance, but also we need to think about sensory needs. That's a lot of places in our environments are just not very sensory friendly. I'm so sensitive to noise, so I don't go anywhere without earplugs. And that's actually true for 2 of my kids too, is we wear noise canceling headphones just to go to the movies, which actually, let me tell you all, you need to, at least earplugs, because it's so high that you can get temporary noise-induced hearing loss. The volume just has gone up for everything. It just seems like Americans are craving stimuli, and it's too much. You know, it's like walking into Times Square for some neurodivergent people just going to the grocery store. You know, there's just too much input all the time. Creating a psychologically safe learning environment where we can talk about differences. So I teach the autism class and the augmentative alternative communication class, and I also supervise in the clinic. So whenever I'm teaching a class or supervising a graduate student who's learning to be a speech therapist, I always ask, you know, how do you learn best? How should I give you feedback? And I ask for feedback a lot about what am I doing that's working? What can I change? And I'm very comfortable self-disclosing because I'm proud of my neurodiversity, and I need to self-disclose because there's times that I'll just do something very funny. One thing that's embarrassing for me is I have such face blindness, prosopagnosia, and I don't know names. So to teach a class,
I can relate to that.
yeah, it's embarrassing.
I stopped being embarrassed. I'm like,
Yeah,
I'm
yeah.
sorry, who are you?
I can meet someone and then turn around and say, hi, my name's Kim. It's really embarrassing. So I always like to let people know so they don't think it's because I don't really like you or just can't be bothered. It's because I really have a hard time with it. And with universal design for learning, you're looking at multiple ways to present material, to help people engage with the material, and multiple ways to show how they're interacting with it. So multiple means of expression. So in designing courses, you know, in the beginning, I would always do, okay, so this is how I'm going to lecture, and then I'm going to give assignments, and then I want you to show that you did the reading by participating on the discussion post. But I've been learning that not all neurodivergent people are comfortable with discussion posts. They feel like they have to mask to communicate. It just feels weird. And so I've been learning about different ways that students can kind of choose how they're going to show their interaction. And I'm trying to learn more about how to do that as a professor. So to support neurodivergent people, we can use multimodal teaching methods. So whenever you're meeting with somebody, a colleague or a friend, multiple modalities is always helpful because something will stick. And if for an ADHD person, I always want a visual. So if you say something to me, I'll say, great, send me a text, send me an email, because I'm not going to remember that. So if you give verbal, so spoken, written, use Canvas, use visual, graphic representations, videos, all these different modalities are really helpful for everybody, not just specific learners. And then offering choice of how a person wants to express that they're understanding or interacting with materials. It can be writing. Some people might prefer to record a video of themselves, an autistic expression, a graphic organizer. My autistic child is completely paralyzed by the idea of writing, but occasionally they'll have a teacher who'll say, okay, let's just let you scribe, you say it and I'll write it down for you. And when they're allowed to do that, they had an English teacher say, that's the best writing I've seen in my 20 years of teaching. But without that accommodation, they get a D in the class. So it's just, people have a real hard time thinking of how else can we do what we've always done. And then scaffolding learning and feedback to provide multisensory experiences based on a person's sensory profile. That can be really important. So even if it's a colleague at a meeting, is have that agenda for the meeting before the meeting, and then have the meeting and then share the minutes after the meeting and keep things open. So someone may during the meeting not be comfortable to share their input because they're just processing. Maybe later they have something to share with the group that they can just share privately or share through an email. Okay.
I love the idea of choices for expression, and I can see how in a liberal arts class that works really well. I struggle in an engineering class to okay, it's math.
Yeah.
You can draw a picture about math. I just I find it harder to understand how to do that.
As a non-math teacher, I have not much to to add, although my child is, so math and science are very easy for them. So they've been pigeonholed as, oh, you love math and science. And they're like, yeah, I mean, I like them. I actually love English, but never do well because of that. But with math, they've struggled because they can do the work. It's just that the teacher always insists on showing the work.
Yeah.
And you say that to a neurodivergent person whose brain works differently, that's masking. It's masking in homework.
Right. What do you mean show the work? I just know.
I
know the answer.
Exactly.
That's
So-
always how I felt like, when I had a math problem and the teachers, like, they tell me that I have to show my work.
Yeah.
Yeah.
What do you mean?
Yeah. So we need to educate teachers that that's actually a barrier.
But hey, at least like in college, at least with like some of my like science and math courses that I've taken, when you show your work and stuff, the professors, like, they give you like points, even though you got like the answer wrong, like they give you points based off of like how
Right.
you showed your work.
That's why showing your work is so critical, but I feel like sometimes, like,
Yeah.
how am I supposed to show that? It's just.
Yeah, I would say like, you don't have to show me work, but if you get it wrong, I can't give you any credit. But if you get it right, then cool, you get full credit.
Exactly. Yeah. So
But when I was an undergrad in some of my math classes, like I actually verbally would speak the math process. Like whatever the question was, I'd be like, first we do this. Like I just
Voice
visualized.
memo.
Yeah, I like
Yeah.
dictated it.
yeah.
Cool.
Yeah. Yeah, so I think it is a struggle, but I think we have to have those conversations. And for an autistic student, like I'm terrified about my child going on to college next year. We've only looked at schools that have great support systems because
Oh, you need to go to
Landmark.
Landmark. Thank you.
we actually didn't look at them. We should look at
Oh my God, you should. It's literally
Yeah.
for neurodivergent students.
Yeah.
We had
They came to visit us and it was
Yeah.
fantastic.
It was fantastic. Yeah, it makes sense. Like you should totally apply. Like,
Yeah,
you
we should look at that.
apply it.
Yeah.
I can connect you with my friend.
All right, yeah, I appreciate that. Thank you. All right,
Thank you. I was like, that's cool.
so this is my final slide and then let's just talk. So neurodiversity affirming practice is starting with presuming competence. I mostly work with non-speaking autistic people. And when I talk to the individuals, I always talk to people like they understand me because I have and I never use the term nonverbal because nonverbal means no language. And that person has language. And I'm not going to test them according to some, norm reference test because there's no norm reference test for them. So I just presume the person is understanding me and I talk to them as I would any other person. And then rather than testing all the time, promote autonomy where our real goal is not to comply with what quiet hands and sit nicely at this table. It's how do I teach you how to say no, how to make choices, and ultimately say, I can't show my work because it's actually in my head. And that's so to be able to do that, that's hard. We have to educate society. But we also have to help people have the confidence and the skills to say, this is what I need in this situation. And respecting all communication styles, that's been such a big one for me. And I constantly have to make myself say, look at what they just did. And I had a goal because parents wanted me to work on saying hi, even though the person couldn't speak, but to say a vocalization for hi or a wave. When I realized, but he's smiling, he's looking at me and he's smiling. So I added that to the goal. And now I consider that a greeting. Like, that's fine. Why not? Be informed by neurodivergent voices. We need to listen to the autistic community. And if we have a question, go there versus go to Google, which is all going to be doctor stuff. Strength-based approach is find out what gives a person joy, what they're good at, and work from there. It's made my life much easier. Honoring neurodivergent culture, see it as a culture. Like how communication happens, how it's all culture. And then it's easier because no one wants to be, racist and biased and all that stuff, right? But that's what we're being when we're teaching someone that you need to mask in order to be a good, successful person. And then tailor supports to whatever the individual needs. So what would you like questions or anything anyone wants to talk about?
Yes, I just met Kim today, and I have a 6-year-old boy who is nonverbal autistic, and I'm spending all my life trying to figure out how does he think? How am I going to, respond? And so I've been absorbing everything you said today, Kim. And it clearly, as you said, the medical versus the affirming, right, approach. And yeah, absolutely. And it's everything I think about so far has been from the medical side.
Right.
To mitigate, to diminish. The thing is, then how do you, and at least I started to learn this only recently, so it takes a lot of
Takes a
accumulative
lot of
learning.
time. And we're never done.
Yeah, and you're never done.
Yeah.
I had go ahead.
No, you-
Oh.
Sarah.
I was about to let Dr. Mona talk.
I was gonna say that I remember meeting, she was a neighbor when I was in Minnesota, and like she was the daughter of neighbors, and she had cerebral palsy, which is different, right? But it did lead to her to have I think like a speech impediment. I don't know if you.
Yeah, probably dysarthria, so it's like weakness.
She just. But what blew my this is what blew my mind. She was telling me how she actually speaks 5 languages fluently.
Wow.
But your average person who talks to her assumes they just yell or speak slow, but she's comprehending everything.
Yeah.
But because literally physically,
right,
she just had to speak very slow, and she couldn't it was hard for her to actually even form the words physically. And it just struck me how frustrating it might be to be sitting there and observing. And
I'm sure some people speak to her like a baby too.
100%, yeah. And
So frustrating.
I've observed it, and how frustrating it would be to just sit there and just observe everything, understand what's going on. But the people in front of you are just no.
Are you aware of the Neurodiversity Initiative in engineering?
Yes,
Great.
Yeah. Spoken with Eric a lot.
Yeah,
That's great.
fantastic.
Yeah, so I'm on the president's council of belongings, and I introduced, brought up the topic of neurodiversity, and we had Eric and Gregory speak. Of course, I think their presence here has made a real difference. So I think we as a college, we as a university, also need to figure out how we're going to deal with this. And I'm myself, interested. I mean, one of the things I'm trying to figure out is how can we now use generative AI? Well, first of all, to generative AI to teach physics, but it will even more so, generative AI to help to work with neurodivergent students.
I have a question. So back in India, I have a cousin who's 6-year-old, and he cannot see. Also, he's autistic. They figured out that he's autistic, and being a 6-year-old, he's not able to even communicate. So by this time, he should be able to communicate. So I was wondering, how can I make them aware to deal with this situation?
I would have them look for their, whatever their chapter is called, but there's an international committee for AAC. It's called ISAC. And every country has a chapter. I'm sure India would.
Okay.
So there are resources they can connect to, but if you go to the ISAC, it's ISAAC website, and to see if there's a chapter.
Okay.
Yeah. Is the question online?
Anon had a question.
Anon, yeah.
Oh,
Yeah, thanks for that seminar. I learned a lot, and I had a question about, I think it was the Compton study that
Mhm.
had, forget the analogy, the telephone.
Yeah, the Kelvin game.
Yeah.
Mhm.
It kind of raised two questions in my mind. One is, there is, of course, an interest to have neurodiverse students work with neurotypical students, that the benefits of diversity in that sense. Is there a study that shows that when you do mix the groups, some sort of data to show certain outcomes being better, being improved by having that diverse interaction?
So you were saying like in a classroom to have a neurodivergent.
Right, a classroom that's diverse, it's a combination of neurodivergent and neurotypical students that interaction among them would improve
Yeah.
certain outcomes. I don't
I
know.
can't pull from my head right now, but I definitely have heard good things about we know increasing diversity is just good for how cultures, how organizations function. And I mean, Northeastern is part of that. We're wanting to increase belonging, excuse me. But yeah, in a classroom and just increasing neurodivergent therapists and teachers and professionals, it's just going to increase people's education about what neurodivergence is. And I think that's a very great point.
There are studies, I believe, like just in disabilities in general, that show that if you actually mainstream students with disabilities, it's good for the entire classroom.
Yes.
It's so not, I don't know about specifically neurodivergence, but and this is why there's a lot of advocacy. So like I was a special ed kid, right? And there's a lot of people advocating that no, mainstream students with disabilities. Like it's good for everyone.
Right.
Yeah.
But you do have to take some precautions because, one of the things, particularly in schools, is bullying. And
100%.
neurodivergent
But like
kids
you're
will be
bullied whether you're in the
bullied.
classroom or like
Well,
yeah.
I think they're exposed more to bullying, right? I mean,
Right. So it has to come with
and I must say
education
that,
support.
I must say the school systems are all very aware of that.
Yeah.
So one thing that actually does come up, so the medical method does have has one implication, which is that if you label it a disability, then you can then assign resources to it. And, and I think that certainly in this country compared to India, you've got far more resources that are available. So if you take that away, what I'm wondering is, how do you then, make sure that you still get those resources?
So most people I speak to say that they do want to be called disabled.
Yeah. I can speak for myself as a blind person. And I don't think the word disabled diminishes me. If that makes sense. So there's an identity and a culture around it.
Right.
Would you say the neurodivergent community is trying to get rid of the?
No, I feel like most are saying I'm autistic, capital A, just like deaf culture, capital D, deaf. It's an identity, but also a disability because there are definite needs that a person
I can
has.
speak to that.
Yes.
I was just agreeing.
Thank you. Great.
So agreeing or disagreeing?
Agree. Yeah.
It is a disability, unfortunately, because we live in a neurotypical world. And so to say things like, oh, differently able, disability is a bad word, it really takes away the validity of the experience, the daily experience, because the world is not built for everyone, unfortunately.
Absolutely. Thank you.
Can I bring back to the point of bullying? I just want to like bring it to unfortunately, whether you're mainstreamed or not, like whether I was in the special ed classroom or in the mainstream classroom, bullying happens. even when you're amongst your peers, like other kids who have disabilities.
I have a personal testimony to that.
Absolutely, no, I agree totally.
Fortunately, bullying is just, yeah, go ahead.
Yeah, I was back in like high school and middle school. When I was young, I was a kid with an IEP, so like I had a learning disability, and
I hear you.
Yeah, like I would have to like go to like some classes. Like I had like some big classes, but how my classes were also like small and stuff, and
But so this going back to the point, you do have to address bullying.
Oh, 100%. But I'm saying
Yeah.
mainstreaming or not is not necessarily the answer.
Yeah.
Like,
Oh, okay,
like
yeah. so you-
taking this kid
Alright.
out of the mainstream classroom isn't necessarily gonna protect them from bullying.
Right.
and
So
then
that's the point that I was making.
it was a lot worse when I was like in middle school though, because like I had like these speech classes. Me personally, I didn't think I needed them because I felt like in the moment like I could express myself very well, but I was taking some of those classes, and some of these kids were like, when I told them I had a speech class, and when I got like pulled out of like my gym class to go to like speech or whatever, one of the kids were like, oh, he's like Martin Luther King or something. Yeah, they said.
He's a great
they said
speaker.
sorry.
What are they talking about?
I mean, in the moment, I didn't take it like to the heart, because I was like, you know what, I don't care. But like I knew they were like saying it to like intentionally like insult me.
Yeah.
Mm-hmm.
I think mainstreaming the kids. So in the school district where my kids are, it's the kids with disabilities are in the classroom with general classroom with helpers. But what it does is it makes the neurotypical kids very comfortable being around those people.
Exactly.
So it's not, oh, that's weird. It's just like,
Right.
oh, they have a helper.
Right.
And I think that helps in educating and
It becomes normal.
it becomes,
Right.
yeah, it becomes normalized, and then you're not
Part of our culture, part of
Yeah.
our community.
It's just they're just different. And
That's a good point, because I think I love seeing in those younger education, even in preschool, they're practicing mindfulness. They are learning how to ask before giving someone a hug or before touch. And I think that is so great, because personally growing up, I had a lot of internalized isms, that you don't know that exists, but is there because it's like internalized biases. It's just that,
Ableism or
yeah,
racism or whatever.
like you acquired it
We all
without
have
knowing it. Yeah, we all
Yeah.
have them, and I couldn't point that out. I didn't know it existed inside me until I learned about this neurodiverse culture, or celebrating the capital deaf community. So I just love seeing that they are teaching that, and spreading awareness starting at a young age.
I have another question. This is sort of very specific to my class. I do a lot of group projects that students present on as teams. Are there useful guidelines, ways to sort of construct teams, or evaluate, or provide rubrics that take into account the neurodiversity of some of the students, and how do you think about that, or what are recommendations?
That's a great question. I don't know that I can give you any definite guidelines, but I know I'm very aware of this, and because I'm so kind of always disclosing my own neurodivergence, a lot of students come to me even if they don't have accommodations. So I'm very mindful of that when I'm assigning groups. And I try, rather than to have everyone sign up for their own groups, that means that everybody, all their buddies get together, and then maybe there's kids or students that are just, feel excluded. I randomly initially assign, and then I mindfully move people around a little bit, so that the groups do seem balanced, but it isn't just best friends together. And then I have each student, like I have in my AAC augmentative communication class, I have a group project that has 4 different components, so that they can learn technology, play with it, do a assessment, and all that, presentation. I have them after each component do a what do you call it? Anonymous, that's the word, evaluation of each of their group members after each part of so I can look at that. And that way I was able to identify there were a couple groups that people weren't feeling like they were feeling respected, and that they could equally share ideas in the group. That was the questions. And are all the people, keeping up their end of the work and all that sort of thing. And then I would just, as a class, I spoke a lot about that of deciding who has what roles in the group, and to sit in a circle rather than I have people just get on the floor and sit in a circle, so that there's no barriers of who's in charge, because there just tends to be that extroverted, often neurotypical student who's like gonna be the leader, and other people may really feel like don't have a part there. So then I'll go and then specifically talk to groups and say, brought to my attention that not everyone's feeling comfortable and heard, and I'd like to just kind of facilitate a conversation that way. I still feel like I'm at the beginning of how to help, though, so I'm trying.
Is it appropriate or advisable to sort of optionally allow students to inform you of their neurodiversity and their preference, for example?
Absolutely. I mean, we can't ask people. And
Right.
if you have someone who has accommodations, we're going to find that out anyway. But I always welcome people. I self-disclose the first day, and I say, if you have any different learning styles or needs or ways that I can better make you feel comfortable with the material and myself in the classroom, then please come forward. I always bring a huge bin of fidget toys. I put them in the front of the classroom, and I say, and the reason why I started doing that is I had a student I was supervising who said, I need to fidget, but I'm embarrassed to fidget with this toy. So I sit in the back of the room and I get nothing out of the class. So that's when I started always bringing a bin of fidget toys. And then I find it's empty. People just empty it. And I say, stand up in the back of the room and walk around, roll around, do what you need to do. And then if you create that culture in your classroom, then people are a little more open, I think, about it. Start talking about their needs.
Thank you.
Thank you.
This has been fantastic. Thank you so
Thanks
much
for
for
coming.
coming.
Thanks for having me.
Perfect. If anyone has any more questions or would like to learn more, I will send Dr. Ho's the email address in the chat. Thank you everyone for being here today. Stay tuned for who wins the $25 gift card. But see you at the next event. Bye.